Hi, I'm Dr. Bojana
And I'm Dr. Teresa.
And today we're going to talk about hypothyroidism, or underactive thyroid gland, as a result of Hashimoto's thyroiditis. So what is thyroid gland? Well, it's a gland at the base of your neck that is responsible for your metabolism. So think controlling your heart rate, your digestion, your metabolism, and how your body uses energy. Well, it's an autoimmune process whereby your thyroid gland gets destroyed by your immune system. Unintended weight gain or difficulty losing weight, low energy, feeling sluggish, sometimes even depressed. They might experience constipation. They might experience feeling cold all the time. And also, in some severe cases, they might experience swelling. Women might experience menstrual irregularities, difficulty getting pregnant, or heavy periods.
You can imagine with that range of symptoms that, making that diagnosis really takes a lot more than the clinical symptoms. So there are laboratory evaluations. Generally, when you see your physician, the first thing they're going to do is just a TSH screen, a thyroid stimulating hormone. But oftentimes we need a more full panel with doing both a T4 and sometimes a T3, but usually really just a thyroid peroxidase antibody, which is like a TPO antibody. That's really pointing towards the Hashimoto's portion of the thyroid.
Exactly. There are some genetic risk factors that might predispose one to developing hypothyroidism, but other factors include diet, as well as previous history of radiation therapy to the region.
Some of the things that we talk about when we're talking about thyroid health are iodine. That comes up a lot, and specifically with Hashimoto's, an increased iodine intake in the diet has been shown to be correlated with an increase in Hashimoto's disease.
Yes. Another supplement that people sometimes ask about is selenium. Selenium is a trace mineral that is essential for thyroid hormone production. There have been many studies done in Europe that have shown that supplementation of selenium can actually reduce the amount of antibody or the amount of the immune response in Hashimoto's thyroiditis. It's also important to know that excessive selenium intake is toxic, so it is not something that's routinely recommended actually.
Another hot topic, which comes up a lot, even outside the thyroid, is vitamin D. It comes up in many things because vitamin D plays a crucial role in so many things in our body. And again, with the thyroid, we've seen a correlation in the study showing that a vitamin D deficiency could be related to increased incidence of Hashimoto's as well.
The interesting thing about iron is that actually iron is necessary for thyroid peroxidase to function. And so you can imagine that it's important in terms of synthesizing thyroid hormone. The other interesting thing is that iron absorption also depends on appropriate thyroid function and normal thyroid function. According to the American Thyroid Association and the accepted guidelines, we don't recommend any routine supplementation. Overall, generally, what I recommend to my patients is exercising good judgment when it comes to general nutrition and wellness, and predominantly eating plants, making sure that you're including whole foods as much as possible, and really sticking to an anti-inflammatory diet, less processed food, and so on. Generally, we start with levothyroxine, and the dosing is based on one's weight and sometimes also based on their age and whether it's subclinical or clinical hypothyroidism, but that's certainly something to discuss with your doctor. Well, we hope that this information has been helpful. Certainly, if you have any concerns about Hashimoto's thyroiditis or underactive thyroid gland, please talk to your doctor. Thank you.